I'm Kelly Warner. Parenting's a tough job, there's no doubt about it. Parenting a child with ADHD is even harder, so you may need a little extra help. The first step is to figure out what's really going on. At Thrive Behavioral Health in Eugene, child psychiatrist Dr. Jennifer Schumann often diagnoses and treats children who have attention deficit hyperactivity disorder, or ADHD, a condition that makes it difficult for young brains to focus.
Another way to describe it to families is just the filter is not there. Whereas somebody without ADHD can sit and talk to somebody and focus on what that person is saying, somebody with ADHD is going to focus on what they're saying, the light coming in from outside, the feeling of the sock on their feet, sounds from outside, and those all have equal priority in their brain.
It's estimated that about 5 to 10% of children ages 4 to 17 have one of 3 types of ADHD.
We have just not able to pay attention ADHD, we have just not able to sit still ADHD, and the more common is a combination of those two.
This inability to focus or sit still often creates disruptions in the classroom and at home and can be frustrating for parents.
It's not that these kids are choosing to be bad, it's that they really have a hard time keeping it together.
If you notice behavioral changes or inattentiveness in your child, talk with your pediatrician.
Because we have a nationally recognized tool that will help us decide, is this a child who has ADHD? Or we can go through a more detailed process where we can refer you to the correct place for your child to have testing.
If a child is diagnosed with ADHD, there are treatment options,
which include behavioral modification strategies, working with the school, working on how you're situating things at home, and possibly medication if it's at that level.
Getting help is important because dismissing the problem or trying to ignore it can be harmful to children.
Because that sends the kid the very strong message of shame and guilt and that there's something wrong with them, that is their fault, or that it's your fault. It's not. It's as medical as asthma or diabetes. But there is a lot that can be done, but you have to start. You have to get started.
Research shows that untreated ADHD can lead to issues with substance abuse, difficulties in relationships and holding a job, even an increase in accidents due to a lack of focus. The good news is that about 50% of kids who have ADHD grow out of it once the frontal lobe of their brain fully develops, which is around age 25. For tips and strategies to help your child manage their ADHD, head to eugenepeds.com/healthykids. I'm Kelly Warner.